Recording in progress. All right. Well, thank you for coming. My name is Leah Sigler. I am the president of the Teledentists, and I wanted to start this series of Facebook Live events to talk to some of the vendors on our marketplace about their products, get to know our Teledentists a little bit better, and to entice people to look into these excellent products. I mean, Dr. Uzbelger has been with the Teledentist for several years now, right, Doc?
Correct.
One of our first, and he has started this exciting new company called 123 Smile that has clear aligners available in your home to fix your crooked teeth. And I mean, who doesn't want to straighten their teeth? Ever since the shutdown, people have been looking in the mirror a little harder, and it's time to fix that crooked smile. So thank you for coming, Dr. Uzbelger.
You're very welcome. Thanks for the opportunity.
Of course, of course. So what enticed you to start this 123 Smile for All?
Yes, I was, as every dentist, working at the office prior COVID-19, but then the pandemic started. They shut down all the offices. So I started trying to help dentists and medical professionals, like printing these masks for getting protected against COVID and being able to see patients. And at the same time, I was doing teledentistry with you. So, and then, pandemic was extending longer than we expected, unfortunately. And then I also started reviewing cases for clear aligners with, the large companies in the niche. So I review more than 1,000 clear aligner cases in a few months. This is more than a regular orthodontist or 1% of orthodontists can do in 1 year. And then I started looking into the history of orthodontics, which is very fascinating because ortho was created practically in the ancient Egypt and Greece and Rome, and then they were trying to fix the crooked teeth. But as you know, it became very popular in the mid-70s because now we can bond the brackets to the teeth. Before they had to wrap it all around. So, and then in 1997, they invented the clear aligners. And as you know, today, all these methods are very popular. But then I started looking to some numbers, and I found that in 2019, 2/3 of Americans are suffering from malocclusions. So, and I was wondering, how come that, if we have orthodontics since the ancient, Egypt and ancient Greek, and we have these awesome clear aligners, how come this is happening in this country? So I found that the reason was that there are two things. One is the high prices of the current treatments. And the reason number two is the inconvenience to go to multiple visits into the dental office, during a long period of time or during several months. So when we put all this together, someone has to do something about this. And this is why I created the 123 Smile.
A light bulb switched on, and we can resolve both of those issues. I mean, you're right. I remember practicing in a dental office, and people would be like, do I have to come back in every month to get my aligners checked? And it's like, really, you don't have to. So can you explain the process a little more? Like, I'm interested in getting my teeth straightened. What would I do for 123 Smiles to be a candidate for 123 Smiles?
Yes, it is like a 1-2-3 approach. First, you contact the company. Then you need to get an eligibility assessment. Okay. And once you are eligible, we will ship you the impression kits. So you can take the impressions at home. Let me share my screen with you to show you.
Oh, sure. Let me make sure you're a co-host. Sorry about that. There you go. Share away.
All right. So you can then get the molds at home. It is very easy. Then you ship us these molds. And we will start processing with the 3D software, 3D treatment plan. So once we get that done, then we will get the approval of the state dentist and also the patient's approval. And finally, if everything is fine, we will manufacture the aligners with the 3D printing technologies, and then we will ship the aligners to your house, and you can start wearing them.
So what qualifications are necessary to be a 123 Smiles candidate?
Yes, that's very important. We need to make sure you are older than 14 years old, or that you lost all your baby teeth.
Okay.
Also, it is important to ensure that your gums are in a good, healthy situation, and that you are getting your dental cleanings regularly.
Yep.
So, which means that your gums are not bleeding. Also, it is important to assess that your teeth are not loose, that you have no broken teeth or a broken tooth or decay or an ill-fitting restoration, or something that can, in your medical history, that can then get worse if you get the clear aligners.
Right. No point in moving calculus around. The
Exactly.
teeth in the bone, especially when you're shifting teeth in bone and you're opening up those to being susceptible to bacteria like periodontal disease. It's very important, thank you, to make sure that those teeth are clean before we shift them.
Correct.
Yep, love it. And I have to say, I did try one of these at home impressions, because in the office you're using it and you're impressing everybody else, but I've never done it on myself, right?
Right.
It was so easy. It was so easy. I didn't realize that I could be such a good impression taker. At the office, it's usually the assistants that do it, or the dentist, and I actually did a pretty good job. So if I can do it, anyone can do it, right?
Right. And the good news is that we will ship you an extra set of putties. In case you make a mistake, you have a second chance to, to redo the impression.
Good.
And then get it right. Mm-hmm.
So what makes 123 Smiles different than Invisalign or Smile Direct, for example?
Yes, I have here another presentation, if you don't mind.
Sure, please.
Share it with you. This is our company. Let me know if you can see it.
Yeah, got it.
Yes, so this is a little bit about the story that I was sharing with you. Let me see. About how we started on this, fascinating industry.
Yeah.
When I was
wow.
doing the mask, then the experience with the Teledentists, the aligners cases that we did, and then the fascinating
That's so
history
cool.
of orthodontics.
Wow, they like drilled
the problem of the 2/3 of the patients, and then we need to close this gap and help them. So, and as you can see, when you ask this question, we practically use very similar materials and processes than all the other aligners companies. Also, we have a similar 3D treatment design. But and we have a very good and experienced network of doctors through the Teledentists. However, the main difference is that the company's gross margin is lower when compared to that of the competition. So in summary, we make less money, but you will get a new smile because we are closing this gap. So we are a responsible pricing company. So this is our responsible pricing strategy. So this is the difference number one. We are also HIPAA certified. This is the only company in the dental aligners industry with this certification, and we have all the other certifications as well. This is our at-home 1-2-3 approach that I was sharing with you before. You get your impression kit, then you ship us your impressions, and we will align your teeth, and then you can smile.
That's awesome.
Here you can see how you take your impressions, as I showed before with the video, and then also we use a very high quality material, actually the best material that I try on myself. This material, I test 3 different materials on myself, and I manufacture the aligners. Of course, also I was reviewing all the research in the field. And finally, the one in the middle was the best one. You can tell that is more clear and it is really comfortable.
It's not as
So,
bulky as the other two.
this is in my mouth. It
Wow.
fits really well. These are some of the properties of this material that we use. It is BPA free.
Excellent.
So, which is very important to differentiate your company. And also, we are the only company out there bilingual or bilingual in English and Spanish, which means that we have the actual kits for you to get the impression, the instructions, the emails that you receive, and if you want to speak with us, we will talk or speak in your language, in Spanish. So we are the only company that really connects with you if you speak Spanish. Also, another difference in between our company and the other companies is that we are the first ever dental aligners company that is recycling or is concerned about recycling, because we need to take care of our planet Earth for our kids and grandkids. Yes. And also, as I mentioned, we are the first HIPAA certified company. This is, yes, we are the very first one dental company accepting cryptocurrencies, including the Dogecoin, if you like.
Awesome.
Those tokens.
I thought you were going to say you're going to correct my dog's teeth.
Maybe someday.
Maybe someday. There you go.
Exactly. Aligners for dogs as well.
That's great. Sure.
Always they will chew it if you put it,
I know, right? For sure.
Exactly. If you put them on the case. And of course, we have a network of dental experts through the Teledentists, so which makes a big differentiation when compared to the other companies.
Absolutely. So I remember when you first were coming out with this concept, we talked about how important it is to monitor teeth while they're moving. Now, that doesn't necessarily mean you have to have your hands in someone's mouth and making sure that it's moving correctly, but checking in every once in a while with the teledentist, correct?
Correct. If the patient requests, we can do so.
Beautiful. So if there's ever a concern about, is this tooth supposed to be this way, or when am I going to reach this goal, they can tap into our teledentist network and talk to somebody about their ongoing treatment, correct?
Correct. Yes, 100%.
Love it. Very cool. So what do you say to people that are looking out there? Like, what would you, I mean, obviously you've just proven how you're different, but what would you say would be the number one reason that somebody should be interested in 123 Smiles?
I think the pricing, because with this responsible pricing strategy, being the only company offering you the same materials, the same processes, and the same outcome. So, yeah, why would you go to another place if you can pay less? Because again, our company is making less money, but it's giving you a new smile. So this is our strategy, and we are the first one doing this.
Love it. And in español también. So
yes, if you speak Spanish and you want to get this service in your language, you can tap us. If you are concerned about planet Earth, you can do that.
Love it.
Also with us, if you want to work with a network of experts, the Teledentists, you can work with us as well. Also, if you have cryptocurrencies and you prefer to pay through the cryptocurrencies, you can use our system. And also, if you are concerned about your data, that it is very important that data is private. So we are correct with the HIPAA compliance.
What are the pros and cons of clear aligners versus braces? That's always a question that comes up.
Right, that's a very important question, because with the clear aligners, we are limited to simple and moderate cases. So we can never perform or complete complicated cases with clear aligners. So if that's so, we will refer you immediately to the dentist or to the orthodontist. Hence
the assessment before. You're not going to pay all this nice money and then be like, oh, actually, you're not a candidate. So that's great.
Correct. That is part of the pre-screening or the screening process, which takes, a few days to make sure that everything looks fine. This is one of the things we do. So if this is a case that is not simple or moderate, or if we need to move premolars or molars, we refer the case to a dental office or to the orthodontist immediately. So to the local orthodontist, because as you know, we are nationwide.
Right.
So the patient should go in the location that they are.
Right. Great. Well, as a hygienist, I remember kids coming in with braces and they were just a mess. not brushing below the brackets and there's just a nice thick layer of plaque, or you take off the braces and there's that lovely white spot in the middle because they've started demineralization from not taking care of their teeth and gums. So clear aligners, I did Invisalign back in the day. Not going to age myself, but it was long enough ago that it was, one of the first patients in this office that I did Invisalign. And
Nice.
being able to take out my aligners, brush, floss, and then put them back in, it just maintains your oral health as you're moving teeth as well.
Correct. So that's the goal. Yes. This also helps preventing a plaque accumulation,
Yes.
tartar, because you can clean it perfectly.
Right.
Yes, you're cleaning.
How do you keep the aligners clean? That's a good question. I remember a gentleman came in and he had green tea or something, and it just absorbed into the aligners.
Correct. It is very important for you when you eat to remove the aligners. Also, if you are drinking tea or coffee or wine or anything that can stain the aligners, you should remove them prior doing so, and then rinse or brush your teeth and floss, and then you can put them back.
Perfect. So what's the average time that you should be wearing the aligners for optimal?
It is correct. Typically from 6 to 12 months. This is the average time. We offer an express aligner system as well. So if you have a wedding or if you have any event that requires speeding up the process, we can offer that.
That's awesome.
As well, but it has a higher pricing.
Yes, getting it done faster. Yeah, that's great.
Correct, because it's a different material. We put 2 layers of the material in one, so it has different properties.
Nice.
And it can move the teeth faster.
That's really cool. I didn't know you did that. That's awesome.
Yes.
And then keeping up with your oral hygiene at your dental office, which again, we can help you find a dental home if need be, correct?
Correct.
Love it. Okay. Well,
or if the dentist or if the patient needs to get something done before getting the aligners to become eligible.
Right. So if it's been more than a year that you've seen a dentist, or even 6 months, check in with the dentist before starting your clear aligner therapy.
Correct. That should be the ideal patient.
How about whitening? Is whitening an option with clear aligners?
Yes, after the treatment is completed, then if the patient wants to do whitening, they can do it on their own with over the counter. They can go to their, dentist, or if they can, they can ask us and we can give them the best recommendations as well.
Excellent. I know shifting teeth, you always want to end with the whitest, straightest teeth, right? So being able to do both with your clear aligners is a plus, win-win for all.
Correct.
Yay. Well, I wanted to share my screen this time just real quick to show everybody where you can find the lovely 123 Smiles ad on the Teledentists. Not a lot of people know that we actually have a marketplace. Most people come to us if there's an emergent case, if they have a toothache or whatnot, but we have an excellent marketplace right here on our main website. And one of our very first customers is 123 Smile. And it is right here. If you click here, it takes you to the home screen at 123smiles.com. So that is the easiest and fastest way from our customers to find 123 Smiles. Basically, Google searching 123 Smiles as well, and clear aligners is going to get you there. Follow them on their social media for all cool information and updates. And then you can also contact the Teledentist if you have any questions about correcting your smile.
Yes, if you want to get this 30 seconds free online questionnaire to find out if you are eligible, you can just tap on that button which says in the lower corner, I'm here to help. And then you just follow the prompts from the bot, and the bot will guide you through this 30 seconds free questionnaire. And then we get all the answers, we get your contact information, your picture, and then we can tell you if you are eligible for the treatment.
Love it. And again, all 50 states, Puerto Rico, soon to be international, hopefully?
Yes, so that's the plan. Working very hard to do so.
That's right. Startup companies are never easy, but man, it's worth it when they take off. Isn't that the truth, right?
Yes, it is beautiful.
Well, thanks, Doc. This has been really fun. I know we said we had 30 minutes, but you just like answered all of my questions so quickly. Is there something I missed that our audience needs to know?
Yes, I think that's all. I think we went through all the processes
Yeah,
and
huh?
steps that they need to know. And if they have any questions, they are free to contact us through our website. We have our email there.
Yep.
There is a phone number as well. They can text us through that phone number. So, yep,
Love it.
we are here to help.
I think what we're going to do is continue having this series of vendors come in and have Zoom meetings with the teledentists. And I'd like you to come back in a couple of weeks and see if there were any people that saw this video and we can answer any questions that they sent to us. How's that sound?
Yes, it will be
Maybe keep it a once a month kind of meeting, chit chat over some
sure.
coffee.
Part
Is that
2,
my
part
theory?
3. Yes,
Okay.
that sounds like a plan.
Okay, you're on. Well, thank
That's
you,
great.
Doc. I really appreciate it.
Thank
Always
you very
fun.
much. I really appreciate it, and good to see you again.
Good to see you too. You have a great rest of your day.
Thank you, you too. Bye-bye.
Bye.